Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. August is National Overdose Awareness Month, a time to remember those lost to overdose, provide space for grief, connection, and healing, and highlight the work happening in our communities to prevent overdose and support recovery. Throughout the month, we're featuring organizations across our community that work to prevent overdose, support recovery, reduce stigma, and connect people with care. Today, we're learning more about the Colorado Health Network with Izzy Pike, Director of Prevention Services, and Rebecca Lara, Prevention Services Manager. Izzy and Rebecca, thank you both so much for joining us.
Thanks for having us.
Happy to be here.
To start, can you tell us a bit about the Colorado Health Network and the work that you do?
Absolutely. So we started in 1983 as a grassroots response to the AIDS epidemic. You know, it really kind of started off as like helping people with end-of-life care, helping them get to their appointments. And then as treatment evolved, so did we. And so we started doing medical case management, all geared towards helping people get undetectable, which means that they cannot transmit the virus to another person. So as we hit that point, then we started looking at other ways that we could expand and what that looks like. So now the routes of transmission for HIV are very similar for hepatitis C and other communicable diseases. And so our executive management and our board just decided that we were going to expand and look at how we can prevent HIV, Hep C, and other transmissible diseases.
What does HIV prevention, testing, and treatment look like in Colorado?
Very robust. We actually do implement multiple evidence-based practices to eliminate the spread of HIV. We have our free HIV, Hep C, and STI tests that we can offer 3 days a week. We also have our case management. They work closely with folks living with HIV to address any types of treatment that they might have, whether it's payment, whether it's insurance. And then we have several trusted providers that we can send folks to.
And then it also looks like PrEP, which is pre-exposure prophylaxis. It's a pill that people can take once daily that decreases their chances of contracting HIV if they come in contact with the virus. It's a pill that they take once daily, and it's 98% effective when taken as prescribed. And that's also how we get undetectable, meaning untransmissible. If you are engaging in all of these prevention efforts, it's virtually impossible to get HIV at this point, which is pretty cool.
Speaking of reaching that point of being undetectable, how has HIV treatment changed over time in the decades that Colorado Health Network has been in this work?
It was really a grassroots response, right? And so it was, I would say, harm reduction in the purest form of like, how can we show up for people and make them as comfortable as possible? And so when it previously started, you know, people were taking 40 pills a day, and that was really just to manage the symptoms. And now they're taking 1 pill a day. And there's even been advancements to the point where there are injectable medications. And so they can get an injection that lasts for 2 months. And there's now a new one coming out where it's every 6 months they get an injection, and it's what they need for their meds, which is really cool.
And then what regions of Colorado do you serve as an organization?
We serve Morgan County, Logan County, Weld County, Larimer County, Sedgwick, Washington, Yuma, and Phillips counties. So the northeast corner of Colorado.
So, Izzy, can you tell us about the work that NCHN does around substance use?
So we really focus on prevention, harm reduction, treatment, recovery planning, and coordination. And there's so many different ways that looks, right? And so for prevention and harm reduction, I'm actually going to kick that over to Rebecca because that's her bread and butter over there.
Yeah, so harm reduction and prevention definitely is all around like the SAP services or syringe access point services that we provide. So safe use supplies, testing strips, naloxone distribution, and then a lot of education just around safe use, around wound care, and then the naloxone overdose response training and handing that out to community partners as well. But we also dabble in a little bit of the treatment aspect in that we do host our Suboxone clinic every Wednesday evening with the Family Medical Center. So we do get a wide variety of folks accessing that every Wednesday night, and it's low barrier. So I believe it is the lowest barrier in the state.
So just for our listeners at home, can you tell us what naloxone is and how it works?
Yeah, it is an opioid antagonist. There you go. Big words. And essentially, whenever there is an opioid that is sitting on the receptor of a brain, it essentially just knocks it off that receptor. It gets the breathing going again. It just helps somebody kind of come back to being able to breathe normally, being able to regulate.
Can you explain what harm reduction is for us?
So there's a few different ways to look at harm reduction. And I think that the way that the National Harm Reduction Coalition does it is best. So there's little h and little r, and then there's big H and big R. And so little h, little r, that's a lot of what we're doing. It's the practical set of strategies aimed at reducing the harms associated with risky activities. To take substance use out of it, if you are driving, that is an inherently dangerous activity. And so harm reduction would be wearing your seatbelt, getting your license, following the laws of the road. And so that's little h, little r. Big H, big R is more of a social movement where we're focusing on how society has disenfranchised folks who use drugs and communities of color. And how do we bring that power back to them? And, not just make space for them at the table, but really kind of recognize that they built the table and therefore they should absolutely be around it. And so that's what harm reduction is to us.
Can you tell us about the numbers of people that utilize your services?
Ooh, good question. In the past month, we did see over 600 folks accessing supplies and about 1,800 interactions total. So it was a pretty significant amount of folks just in the past month. So just for the month of July, since we are always doing our reporting, we have had 29 reported overdoses reversed, which is great. And again, that is just self-reported reversals. We could have had more, which is a win for the community. But that's just the number of people that are comfortable sharing that information with us. 140 overdose reversals for the calendar year thus far, 251 reversals last calendar year, which is pretty significant as well. And then just to get a little into the weeds here, we've had about close to 2,000 doses of naloxone distributed out into the community and around 290 trainings thus far this year.
Wow.
And just to chime in with some state numbers, last year we actually had 2,000 overdose reversals reported to us.
That's amazing.
And so, it's really the sense of like people who use drugs are the first responders in this situation. And so how do we get the tools to them so they can save a life, essentially, right?
I was hoping you could tell us a little bit more about that overdose prevention training, that naloxone training. What does that look like?
We offer it to everyone and anyone. So I think everybody should be equipped with some type of training. So we offer it to CSU students. We have undergrad students that have asked us to train them. We have different community partners that are just working with folks that might have substance use and they want to know what's the best way to respond to an overdose. So really anyone and everyone. Sometimes it's somebody that comes in and they just have a family member that they know is using opioids. And so they want to know what's the best way to support in case of an emergency.
Gotcha. So I know that naloxone is being stocked more in first aid kits and around different organizations. I am kind of curious, though, what would you say to somebody who was maybe feeling a little bit apprehensive about maybe administering it? Is it an involved process?
It's similar to an EpiPen, some might say, depending on the type of naloxone you're administering. So we do have the injectable naloxone, which is, again, similar to the EpiPen in that you would inject it even through clothing because the syringe is big enough to kind of poke through like a sleeve or a pant leg. And then we also have nasal, which is also pretty low maintenance as far as like you don't need to necessarily make sure that somebody is properly adjusted, just that it is soaked through the nasal membrane. So yeah, even if they aren't breathing or they don't seem very responsive, there's no wrong way to administer naloxone.
And Rebecca, can you tell us a little bit about these fentanyl test strips, just what they are and how they work?
So they are essentially a tool that folks can use to test whatever substance they're using. They dilute the substance, and then after it's diluted and mixed in well, they use the test strip, submerge it in the water for a couple of seconds, and it'll either show a positive or a negative. And again, that is to help folks, whether it's they are seeking a substance or they're trying to avoid a substance, and then it gives them a more informed approach. Again, puts the ball in their court, provides that autonomy that we want to encourage with our folks.
To jump back a little bit, you mentioned the open Suboxone clinics that you offer.
Yes.
Can you explain what that is and how it works?
So like Rebecca said, we partner with Family Medicine Center, and rotation of their residents come and provide this service to us. it's low barrier, high access. And so that means that they looked at the standards of care for medication for opioid use disorder, formerly medication assisted treatment, and they stripped off every barrier that they could to ensure that they could get this medication. And so what Suboxone is it's an opioid agonist. And so instead of, where naloxone, where it just kind of would go and cover our opioid receptors, Suboxone's going to go in and have little bubbles and kind of fill our opioid receptors. So then it satiates the need of like getting that substance, and it kind of helps curb the craving. And so it's really the medication that's aimed at helping a person gain chemical control of their brain again. It takes almost 18 months for our brains to repair after we use a substance. And so Suboxone is a really wonderful tool for folks to just kind of like figure out what they need to do with their life and go from there. And so they come in once a week for scripts at this point.
Yes.
But this has been going on since 2018. And so we have folks who are getting, monthly scripts and are wildly successful on this medication.
Colorado Health Network also provides some behavioral health services. Could you tell us a little bit more about that?
During our syringe access hours, we also have what's called Connect, and that is our behavioral health team. Folks can stop in, they can chat with a Connect provider, whether it's external processing, trying to get an emotional support animal letter done, or gender affirming care letters as well. So they really are trying to connect you to the whatever resources you need or whatever supports you need for the day based off of what goals are.
And they can also move to a point where they're providing therapy for folks too. And so initially it starts off as anonymous, right? So low barrier, high access. And it has the potential to grow based off of what that person needs. It really kind of just starts off as a warm hello during an intake for a syringe access participant. And then it kind of grows from there. We've actually had several folks engage in this program, and it's been really cool to see it happen.
We've also talked about your syringe access programs. Can you just explain what a syringe access program is?
So I think a lot of folks, when they think of syringe access, they might call it syringe exchange. We are not a traditional exchange in that folks have to bring used syringes to us in order to get ones. It is all about, again, just having safe use supplies, some sterile supplies. We are trying to prevent any spread of viruses, any exposure to bacteria, and just making people feel well-equipped and welcomed. We don't want to coerce people into supplies. So saying, if you give us this, we'll give you that. It's all just about what they need for the day and how we can support them.
Where are those services available here in Northern Colorado?
That would be our Greeley office. And then we also have our Fort Collins office.
And what sort of impact for communities have we seen these programs have?
We've actually seen a tremendous decrease in HIV transmissions. And while I don't have data to support this, but I'm going to say it anyway. So it's a lot cheaper to give someone a 10-cent syringe and the supplies that they need to stay safe for themselves and a space to come dispose of their syringe than it is to pay for someone to go get wound care at the emergency room, than it is to pay for someone to go through their endocarditis or, any skin tissue bacteria or even HIV or Hep C, right? It's $4,000 a month to treat HIV. It's $86,000 a year to treat hepatitis C. And so I would say there's a huge fiscal return on investment, but there's also a social return on investment in the sense of you have somewhere where people can safely dispose of syringes. They're not throwing it on the street. They're not just putting it in their trash and then risking the safety of, a needle stick for a garbage worker or needle stick for law enforcement officers. It's really, I don't know, it's a wonderful public health measure. And so, I don't know, I feel very lucky that Northern Colorado has invested in this.
Another question I had was just in regards to that syringe access program. Is that just state funds, or are you guys relying on any kind of federal funds?
So we are currently funded, and we're very grateful to be funded through the Larimer County Opioid Council. And so if you're not familiar, the opioid settlement funds are a result of this huge lawsuit that happened nationwide against the Sackler family and other parties that essentially overprescribed opioids and caused the opioid epidemic.
How did the Colorado Health Network land on these priorities for services?
As we discussed earlier, it was really kind of about routes of transmission and what that looks like for HIV. And so if we look at those fluids and when we're coming in contact with those fluids, we're also looking at hepatitis C. So hepatitis C is spread just by blood. And then if we look at the activities in which you're coming in contact with those fluids, you're looking at sexual activities and you're looking at substance use. And so, Colorado Health Network, as we saw the evolution of the AIDS epidemic, as we started seeing the opioid epidemic, Colorado Health Network was like, all right, we're going to focus on this.
Are there priority populations that you serve as an organization?
Primarily people living with HIV and who are potentially impacted by HIV and other medical concerns.
What risk factors and, on the other side, resilience factors uniquely impact the groups that you serve? Big question.
That's a big, we could have a whole hour on that one. Go for it, Rebecca.
I think that there is a lot of stigma as far as the folks that are accessing services. And when you think of syringe access, I think just the word syringe in general is like a scary word for a lot of folks. And so that could be anybody that uses a syringe, whether they're diabetic, whether they're using substances, or whether it's for hormone replacement therapy. So I think there are like a plethora of folks that really are trying to access supplies and in an affordable and safe way. And so there are going to be a lot of risk factors as far as like, what's the best way I can access these supplies? Is it through a friend? Is it through reusing my current supplies that I have because there's too much shame or stigma surrounding the supplies that I need currently? And I think it does build some resilience as far as like trying to have these conversations with providers and doctors' offices, trying to have these conversations with family members or other community members.
When we think about harm reduction, a really common phrase that people say is nothing about us without us. And so at the end of the day, if Colorado Health Network stopped existing, and I won't knock on the table because you told me not to, but, knock on wood, people are very resilient and they are going to continue forward and taking care of each other in the same way that they did before we existed. And I think that really speaks volumes about the folks that we serve because, they show up in community and they care for each other. And that's a really special thing. And so I think that the community itself is a resilience factor.
So, in the number of years that NCHN has been doing this work, how have you guys seen substance use in your response change?
I have been fortunate to be with CHN in some capacity since 2015. And initially, when I started, I was an HIV case manager, and they took me under their harm reduction wings and they taught me all the things. And so it was very quiet. Syringe access and harm reduction, it was a very quiet thing that we did. And I don't know if that was because funding was limiting us at the time or, what that looked like. But we didn't go out in the community and wave our harm reduction freak flag. Now we wave our harm reduction freak flag. And so we've seen an evolution with that. We've seen an evolution in how we care for people who use drugs in our community. I think that the health department and the health district and Summit Stone, Northern Colorado Health Alliance, all of these wonderful community partners have really just kind of shown up to eliminate stigma, to educate the larger community about mental health and substance use, because, they are often co-occurring. And so I've seen a lot of progress, specifically in Larimer County, about how we're showing up for folks who use drugs in our community.
How would you say Larimer County is different, or is there anything unique about Larimer County from the other counties that you support?
I come from a different county, so I do think that Larimer County definitely is more collaborative in how they're addressing opioids in the community, whether it's through law enforcement collaborating with us, your local syringe exchange, whether it's the health department. I think that everybody is really just like they have their stuff together, right? We're all after the common good, and I can appreciate that.
There is legislation that supports harm reduction, naloxone administration, and syringe access programming. And there are counties that even when it's legal and even we do the appropriate stakeholder engagement, they don't want us there. And, it's a lot of the NIMBY, not in my backyard, or like, oh, well, we don't use drugs in our community. Come on, let's talk about this. Like, drugs are definitely used in our communities. And so I think that Larimer County has like an openness of looking at it from a legal perspective, but also like Larimer County is also a very educated community. And so like when they hear the public health of it all and they hear the fiscal return on investment and all of that, it's a very sensible solution to a problem that's not going to go away.
We talked about this a little bit earlier, but how does stigma impact the work of prevention and harm reduction?
Significantly.
Yeah. Next question. No, I think that I was looking at statistics the other day as far as like, I know we touched on overdose response, and there's a stat out there like 1 in 3 overdose reversals is done through a bystander or somebody else in the community that just so happened to be there. And so I think removing stigma means removing those barriers to accessing things like naloxone, in which folks would probably be more inclined to help save a life, or there would be more life saving tools out there. I do think that because there's so much stigma around substance use, that it's hard to find the right sources or resources for assistance, whether it's a Suboxone clinic or a syringe exchange or a syringe access point.
Yeah, I would say that so often we attach morality to substance use. And like, we've been socialized as a society to view it as a moral issue, like, oh, you use drugs, therefore you are bad. And I think like that's how it impacts us. So even though people might look at us thinking that like we're enabling people who use drugs, people are going to use drugs forever and ever. Amen. We always have. And so how do we keep people safe? How do we keep people alive? Because someone is somebody's everything, right? Like you never know who's walking through our doors and accessing services.
What steps do you think we can take, either as individuals or as a broader community, to help reduce that stigma and better support those impacted by substance use and overdose?
Substance use is not going away as much as a lot of folks might not appreciate it. There is always going to be a level of substance use out there. And so making sure that we are accepting and like, this is where this person's at, and how are we going to help you reach your goal today? How are we going to be supportive of you today? I think those are really important things that we can ask ourselves, whether it's as a doctor, whether it's as a neighbor.
I would just say talk about it. It's not going to go away if you don't talk about it. And so I think if you hear somebody say something stigmatizing, my favorite thing to do is pretend to be confused and then have them explain themselves. And that works very well every time, to be like, okay, let's talk about the fallacies here. And so I think the more that we talk about it with our inner circles, with the people around us, the more that we challenge those ideas, the better that we're going to be. And that's how we can tackle it.
Is there a story that you could tell us about maybe somebody who's used your services?
I was really fortunate to actually be a part of building up our clinic with Family Medicine Center. And it was so incredible to see the way that Dr. Marchant was teaching these residents how to show up for folks. And, on the flip side of the coin, how our participants were teaching the residents how to show up. Like they were going to talk to them about harm reduction and like how to engage in the space. And I'll never forget, we had this one individual who was using multiple substances, right? So they were using meth, they were using heroin. And, we always tell people, let's shoot the alligator closest to the boat. You're going to want to, like, it's not the meth that's the scary one. For them, it was the heroin. And so we got them on Suboxone, we got them engaging. And they had been turned down several times from other health clinics about their concerns with like scars on their face, because they were told like, well, if you would just stop using meth, you'd be fine. And our physicians listened to them and said, okay, well, let's go get you some, I think it was like tea tree soap or mint soap. Turns out this individual had scabies. And like in our building, they were able to build trust with a healthcare provider to address their needs. And then that person went and established primary care with the doctor who helped. Each moment that someone engages in our services brings out the humanity in what we're doing. And so to me, that just always makes me happy. Like you hear lots of wonderful stories about people showing up for folks, but that one, I don't know, it was cool to watch a doctor change his mind and really show up for that person.
Engaging with somebody through STI and Hep C testing and letting them know, by the way, like we also offer these services at our location, down the street. And so then this person came down to access services for supplies. And then within like the second or third interaction, they were accessing our Connect services because they were having a lot of different things that they were trying to process, a lot of different emotions, going through crises. And our Connect team was able to then connect them to outpatient treatment because they were just in a phase where they're like, I think I'm done with this. I'm ready to pursue different avenues. And so they were connected to outpatient treatment. And it's kind of just been like a roller coaster, right? They come back in and they let us know, like, here are my updates. This is what's going on with me. Is this provider for Connect here so I can talk to them about it? Or They've said, can I come and talk to one of the local community partners that are embedded in your space, like Sober Is? We have great peers that are also there offering their services. And so I think wherever folks are, whether it's in active use or whether it's, they're already in recovery, there are a lot of supports in our space for them, and it's a safe space. So they know that being in the space doesn't jeopardize whatever sobriety they're pursuing. But at the same time, if they're done with that journey, we're not here to say, oh man, you're back. We're just here to say, okay, what do you need for today? And we help get them what they need. And, we're here tomorrow for whatever the next need is.
What brought both of you to this work?
It was a fluke, is what I would tell you. So I was previously working for another organization, and I had to break up a fight among teenage boys at 7 a.m. on a Sunday morning. And I was done. I knew that I wanted to be in social work. And so I kind of rage applied for CHN. I heard about it at the time, it was NCAP. I heard about NCAP all the time. So I'm like, sure, I'll try it. And I fell in love with it. I really fell in love with the way that the organization shows up for the community. I fell in love with the people. I think that the people that we serve are truly some of the best people that exist. And it was really bizarre to have people say, this is the first time that I've had someone look at me and say hello today. And so being able to be a space of comfort and a space of love and acceptance for folks is really special. I took a sabbatical, is what they joke about. And so I left thinking I was going to go change the world in another profession. And after a year and a half, I practically begged to come back because I was like, I miss it so much. It's a very weird, unique job, and I'm grateful for it every day. Once you start, you find out all of the connections that you have because, my family doesn't talk about substance use or HIV. And I found out a lot of things after I started working here because they were like, oh, this is relevant to you now. And so I had connections that I didn't even know I realized.
I just have always worked with vulnerable populations. So worked with adults that have developmental disabilities in group homes, did some home health care for a while. And then I got a foot in the door with case management for folks experiencing homelessness. That definitely broadened the horizon as far as what are the barriers that folks are facing nowadays? What stigmas are they facing and why? And after I started digging around a little bit more, doing some soul searching, I was just like, wow, our folks, whether it's somebody who is newly unhoused or somebody who is just not stable in current situation, the community supports are lacking. And so trying to find different ways to fill those gaps in community support, I stumbled into CHN. I heard its name a couple of different times, and I was just like, there's that name again. What is CHN? And then met Izzy along the way. She's like, you should apply. She convinced me. She's like, you should come this way. So I applied, and here we are today doing some harm reduction, and it's been great.
Is a CHN doing anything in recognition of Overdose Awareness Month?
We are out of our Fort Collins office. We are encouraging folks to come in the 24th through the 28th. That whole week, we have different slips that we're encouraging folks to fill out just around encouraging messages, names of loved ones, whatever you really want to write on it. We have some very passionate staff that are into origami. So they will be folding all of these little slips into flowers. And then on the 30th, we will be doing a ceremony from 5 to 6 o'clock, kind of just holding space for folks that have lost loved ones or to celebrate lives that we were able to save during that time as well.
So if listeners would like to know more or get involved with your organization or just support your work, where can they go?
ColoradoHealthNetwork.org. They can apply as a volunteer. They can make a donation. Or they can apply. We are hiring currently. So if you are in the market and you like what you've heard today, I encourage folks to apply.
What kind of positions are you guys hiring for?
In Fort Collins, currently a program coordinator, which gets the best of both worlds as far as working with case management and with the prevention team. They are the middle ground.
Neat.
Mm-hmm. And if all of that seems intimidating, just walk in. Our staff, they're chatty, they're funny. We will welcome you with open arms. We will help you get to where you need to go.
So if someone is struggling with substance use or knows someone who is, what resources would you point them towards?
We have a wide range of community partners right now that we collaborate with. Yeah, there's a lot. Come on in. We'll get you connected with somebody. If you don't know where to start, definitely encourage you to start with NCHA.
And I would add, Northern Colorado has done a really tremendous job of creating a hub and spoke model when it comes to substance use. And so there's essentially no wrong door. So wherever you go, we're going to make sure that you get to the right place because we're here for the person's success and not for the agency's glory.
Thanks for sharing and spending some time with us today.
Thanks for having us.
Thank you.
You can find links to learn more about the topics we discussed today in the show notes. If you have a question about public health in Larimer County or a topic you'd like us to discuss, let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.